All right, first what I would do is I would verify the order and then make sure that the patient doesn't have any allergies to latex and iodine. And then I would go ahead and knock on the door, introduce myself, and then identify the patient. I would explain the procedure, and then what I would do would be to position the patient. For a male, it is to spread the legs and to slightly bend them to allow for room. And then I would raise the bed up to working level. And then I would provide lighting, and then I would provide for privacy. And then at that point, I'm going to don some gloves. And then I would perform perianal care as needed or as indicated. And then I would take off those gloves. And then I would drape the patient. With the absorbent side down. And then once I have sterile gloves on, I can adjust that as needed. And then at that point, I'm going to go ahead and open up my lube. And then I would drop that. And then I'm going to go ahead, open up my gloves. Step away. Put on my sterile glove. At this point, I would need a new pair of gloves. So I would call a nurse so that I could get a new pair of gloves.
She's getting them now.
Yes, all right, awesome. Thank you.
Is a large work for you?
Yes, I need a large, please.
Delivery.
Thank you. I appreciate that.
No problem.
Since this is in a non-sterile package, I would lay them on the sterile field. I would not open them over my sterile field so that it doesn't get contaminated. I'll go ahead and open this new package. Got that on. I'm going to, from the inside, Alright, now I have my sterile gloves on. At this point, I cannot lower my hands below my waist. I'm going to go ahead and take the cap off my lube. And then I'm going to move this down here where I can now manipulate my field. Drop that in the trash. And then I would pour the betadine on the swabs. And I would first attach the water to the catheter. Alright, from there I have to cleanse the penis, so I'm going to use my non-dominant hand. If there's any foreskin, I would pull that back. This is a circumcised male, so what I'm going to do is I'm going to take the cotton swab and start from around and work my way down, toss, and do that a couple more times. Once that is done, I'm going to go ahead and inject all 10 mils of lube into the urethra. And then what I'm going to do is I'm going to insert the catheter while putting the penis in a taut upward position. I'm going to go 1 to 2 inches from the catheter and start inserting while having the patient take deep breaths in case of pain. I would keep my hand there, and then once I have the catheter all the way, I would go ahead and insert water into the balloon. Once I've done that, I would give it a quick tug. Once that is happening, I would then be able to let it go, and then I would make sure to strap the the catheter tubing to the leg, and then I would attach the bag to the non-moving part of the bed. At that point, I can remove my sterile gloves, and I can begin to discard my supplies, and then I would cover the patient up, make sure they're comfortable. I would leave the penis in an area or in a direction or placement that is comfortable for the patient, while allowing them to be able to ambulate if they need, leaving room to ambulate if they need to. I would cover up the patient, leave the call light, lower the bed to a safe position for the patient,